Hi everyone. Today I'm going to talk about some of the different types of headaches, focusing more on migraine and migraine subtypes, and I'll also talk about some of the more rare types of headaches as well. So thank you everyone for joining me today. I'll give you a little background about me before we get started. I'm Dr. Hindiyeh, and I am a neurologist and headache specialist at Stanford University. I did my fellowship training at Stanford in headache medicine and have since continued on there as a clinical assistant professor. So today I'll spend about 15 minutes talking about some of the different headache types, and then I'll spend about 10 minutes answering some of the questions you may have about the topic. Good evening, everyone. So I'll break this down into three major categories of headache. The first being migraine, and I'll discuss some of the subtypes there, including both episodic migraine, migraine with and without aura, chronic migraine, and medication overuse headache or rebound headache. I'll spend most of the time today focusing on migraine and these different subtypes. The second major type of headache I'll talk about is tension type headache, and the third are the trigeminal autonomic cephalgias, otherwise known as the TACs, and I'll discuss the two most common, which are cluster headache and hemicrania continua. So I'll talk about how common each of these headache types are, and also some of the characteristics of each of the headache types, including headache frequency, duration or length of the headache, location of the headache, the severity or intensity of the headache, and associated features such as nausea, light sensitivity, among other features. So let's first talk about migraine. As we know, migraine is a disabling neurological condition. So let's break it down a little bit more. Migraine is common. It affects over 37 million Americans and nearly 15% of people in the world. So that's about 1 in 7 people. It is more common in women, affecting about 18% of women in the US and about 6% of men in the US. So let's talk about the frequency of migraine headaches. The best way to really accurately document how often you're having migraines is to keep a headache diary or journal. And there are many ways to do this. Now there are several apps out there for smartphones that help you keep track of your headaches, or you can write it out on your own paper calendar. So in terms of frequency, episodic migraine occurs when you have less than 15 headache days a month, and chronic migraine occurs when you have more than 15 headache days a month. Keep in mind, not all of these days have to have migraine features, and I'll discuss those in a little bit. So let's talk about how long migraines usually last. A migraine can last anywhere from 4 to 72 hours. However, for some people who have chronic migraine, they may feel like they have a constant background headache that doesn't really go away and have more intense spikes of pain that can last several hours to days on top of that. Chronic migraine usually develops after a slow increase in headache frequency over months to years. And about 3% of people with migraine each year will transform to chronic migraine. Oftentimes, chronic migraine is misdiagnosed because many of the headache days may not all be severe with migrainous features such as nausea or light sensitivity. So even if you have a mild headache, it's important to keep track with a headache diary or journal so you can accurately see how many headache days you're having in a month. And in terms of headache location and migraine, this can be quite variable. So some people experience headaches mostly on one side of the head, but they can often occur on both sides, they can shift sides, they can be all over the head, they can also affect the neck and even the face. The pain is usually described as either throbbing or pulsating. And in terms of how severe, how intense migraine is, it's typically moderate or severe pain. And this will vary from person to person. So again, the best way for you to really know how severe your headaches are, or if they're changing, is to include this in your own headache diary. So you can use a scale such as from 0 to 10 and write down a number every day of your pain severity, or you can break it down into categories such as no pain, mild pain, moderate pain, and severe pain. So let's talk about some of the features most commonly associated with migraine. Many people with migraine can have associated nausea and sometimes will even vomit with their headaches. Most people with migraine will also have sensitivity to light, which is also called photophobia, and sensitivity to sound, called phonophobia. Some people may also have sensitivity to smell, called osmophobia. People can also experience a worsening of headache with activities you would have normally been able to do, such as walking up the stairs or bending down to pick something up. And about 30% of people with migraine experience aura, which is a complex of neurological symptoms that happens typically before the onset of the headache pain. And this can usually last anywhere from 15 minutes to an hour. And these symptoms can include changes in vision, such as seeing zigzag lines or dark spots. It can also affect your sensation, where you can feel numbness or tingling on one part of the body. And it can also affect your speech with either difficulty communicating or finding the right word to say. So also in people with migraine, they can experience symptoms many hours to days before the headache even starts, called a prodrome. And some of these symptoms can include feeling irritable, depression, yawning, increased urination, sensitivity to light and sound, difficulty concentrating, fatigue, and muscle stiffness and nausea, among others. And after the headache, people can experience what's called a postdrome that can last many hours to even a couple of days. And they experience symptoms such as difficulty concentrating or comprehending things, a depressed mood, and fatigue. And keep in mind, not everyone with migraine is going to experience all of these symptoms. They're going to vary from person to person and even vary from headache to headache. And many people can have both migraine without aura and migraine with aura. And both of these can even transform into chronic migraine. So one other headache type that can be a pretty big risk factor for transformation from episodic migraine into chronic migraine is medication overuse headache, or rebound headache. And I wanted to talk a little bit about that here. So medication overuse headache, or MOH, can look like migraine headache, or it can look like tension type headache, which I'll discuss a little more about next. But MOH typically occurs with the overuse of medications that are used as needed for pain. So these can be over-the-counter medications like acetaminophen, naproxen, ibuprofen, or prescription medications such as the triptans like sumatriptan, or opioid medications, or medications that contain butalbital. MOH can also occur from a combination of any of these types of medications. And the more days of these medications you take, the more likely it is for them to cause rebound. So generally what I tell patients is the rule of 10. Limit the use of all these as-needed or rescue medications to no more than 10 days a month to avoid rebound or medication overuse headache. I also have them write down in their headache journal each time they take a rescue medication to keep track of how many they use in a month. So now let's move on and discuss another type of headache, which is tension type headache. So tension type headache is actually even more common than migraine, and the most common type of headache overall. These affect up to 75% of people in the world. And in terms of frequency, they can be infrequent, typically occurring less than once a month. They can be frequent, occurring about 1 to 14 days out of the month, or they can be chronic, occurring more than 15 days out of the month. So the duration of tension type headache can be anywhere from 30 minutes to a week long. And in terms of location of tension type headache, they're usually on both sides of the head. Typically they feel like a tightness or a squeezing sensation, like a vice grip is around the head. And the severity is more mild than migraine, usually considered mild to moderate. They are not disabling and do not usually bring people into the doctor's office. And in terms of associated features, a good way to think about tension type headache is that it's essentially featureless. So there is no significant light or sound sensitivity or nausea. Occasionally, one of these symptoms will be present, but it would be mild if it is. And also with tension type headache, routine physical activities do not typically make the headache worse. So now we'll discuss a couple of the TACs, specifically cluster headache and hemicrania continua. And unlike migraine, cluster headache is rare. It occurs in about 0.1% of the population worldwide. And it actually affects more men than women, about men 3 times more than it does women. In terms of frequency, cluster headaches occur in clusters, like the name suggests. This means they occur typically daily or a few times a day for a few weeks to months at a time, and then stop. Typically, they'll stop for several months or even years at a time, and then the pattern typically repeats itself. The duration of pain during a cluster headache is quite short when in a cluster and lasts usually anywhere from 15 minutes to 180 minutes. And in terms of location, they are strictly on one side of the head, often behind one eye, and don't shift sides or really travel to the whole head. Cluster headaches are very severe and typically described as sharp or stabbing pain. They are associated with various specific features that occur on the same side as the headache, and typically someone will have one or more of these features. They include things like a red eye or a droopy eyelid, tearing of the eye, a small pupil, a runny or a stuffy nose, sweating or swelling of the face, or a feeling of fullness of the ear. And all of these, again, only occur on the same side as the headache itself. And unlike migraine, where people prefer to lie in a dark, quiet room, people with cluster headache feel restless and prefer to pace around during an attack. So finally, I want to talk a little bit about another TAC called hemicrania continua. So hemicrania continua is also very rare, and it actually affects women more than it affects men. In terms of frequency and duration, it's actually a constant headache with pain that's 24/7. It is also strictly a side-locked headache, so it doesn't shift sides, it's only on one side of the head. And the severity is usually a constant moderate pain with spikes of worsening pain that can last anywhere from 20 minutes to a few days. And similar to cluster headache, on the same side as the pain, there is at least one of the following symptoms of either a red eye or a droopy eyelid, tearing of the eye, a small pupil, a runny or a stuffy nose, sweating or swelling of the face, or a feeling of fullness of the ear.